Video 1. Title: Early Signs of Pulmonary Fibrosis That You Shouldn't Ignore. Pulmonary fibrosis often begins subtly, and many people overlook its early warning signs. A persistent dry cough, increasing breathlessness, and unusual fatigue are among the most common symptoms. You may notice that everyday tasks, walking, climbing stairs, or even talking, become more difficult. These changes are often gradual, which makes them easy to dismiss as aging or lack of fitness. However, according to the NHS, early recognition is important. While pulmonary fibrosis cannot currently be cured, early diagnosis allows for earlier treatment, which may slow progression and improve quality of life. Some people also experience chest discomfort or reduced exercise tolerance. Others may feel unusually tired even after minimal activity. If these symptoms persist for more than a few weeks, it is important to seek medical advice. Your GP may recommend tests such as chest scans or lung function tests to investigate further. Ignoring symptoms delays diagnosis, and early action can make a meaningful difference. Listening to your body is one of the most powerful steps you can take. If something feels different, it is worth checking. Because when it comes to lung health, early awareness matters. On a video 2, title: What Causes Pulmonary Fibrosis? Key risk factors explained. Pulmonary fibrosis refers to scarring of the lung tissue, which makes breathing increasingly difficult. In many cases, the exact cause remains unknown. This is known as idiopathic pulmonary fibrosis, IPF. However, several risk factors have been identified that may contribute to the development of the condition. Long-term exposure to environmental pollutants is a key factor. Dust from industries such as construction, farming, or mining, as well as exposure to mold, bird droppings, or certain chemicals, can damage lung tissue over time. Smoking is another major contributor and significantly increases the risk of lung damage. Certain medical conditions are also linked to pulmonary fibrosis. Autoimmune diseases such as rheumatoid arthritis or lupus can trigger inflammation that leads to scarring. Additionally, some medications, particularly certain chemotherapy drugs or long-term use of specific antibiotics, have been associated with lung fibrosis. The British Lung Foundation highlights that genetic factors may also play a role, especially if there is a family history of lung disease. Age is another factor, as pulmonary fibrosis is more commonly diagnosed in people over 50. Understanding potential causes and risk factors can help guide both prevention and management. While not all cases can be avoided, reducing exposure to harmful substances, quitting smoking, and managing underlying health conditions can make a difference. If you are concerned about your risk, discussing your medical history and lifestyle with your GP is a sensible step. Awareness is powerful. It allows you to take informed action and protect your lung health wherever possible.